Okay, hello, everyone. Thank you for joining our Friday Public Health Launch Conversations series. This time we are talking about continue the conversation about why it is important to reform the foster care system in our state. This again is continuation of part one and part two that we started. Part one in November the 5th last year. We had at that time Senator Jose Menendez and Kate Murphy from Texans Care for Children. Then on January 14 of this year, we had Lauren Garrity. We had Senator Menendez again, and attorney Catherine Estrada from Dallas. And the moderator at that time was Representative Ina Mint Harris. And we had a great session too at that point. And today we are honored to have the full complement of speakers and experts on this issue. We have Senator Menendez, a state senator serving District 26 in San Antonio since 2015. We have again Kate Murphy, who is a senior policy associate at Texas Care for Children. Lauren Garrity, chief strategy officer at Communities in the School in San Antonio. And again, attorney Catherine Estrada, who works at the Dallas County Public Defender's Office, working with families and children in the foster care system. The main goal of part three is to update our attendees about legislative and organizational progress which have occurred or intended to occur in the foster care system since November last year when we started this series. We also need to restate again the troubling realities of the system. And in addition, we wanted to leave plenty of time for Q&A, which we didn't have last time. So thank you again to the speakers today for participating. So as a moderator today, my suggestion would be initially for each speaker to initially take about maybe 5 minutes to talk about your current position, legislative and advocacy work, work with children, youth, and family in the system, and your current work and activities to reform it. I know this is a lot, but I'm sure you can summarize it. Your statements would be followed and amplified by answers to specific questions from the attendees and from questions from me that have been prepared in advance. Having said that, let's go ahead and get started. Senator, do you want to get started?
I'll be more than happy to, Doctor. Recently the Lieutenant Governor has appointed a specific committee with the purpose initially the purpose was to sort of conduct an investigation into what happened at a facility in Bastrop called the Refuge. And what's happened since then, we've come to the realization that the issues with the Refuge are just the tip of the iceberg, very symptomatic of much bigger problems in the system. The system has come to the problem that we are all reading about in the newspaper and seeing on the news is when a child is either being exploited or has been in an accident or something's happened, and then the investigations bring to light that they've been sleeping in offices of state agencies, that they've been sleeping in hotel rooms, that they've been shuttled. One child that was interviewed recently, I believe she was 15 and been in 15 different placements, one or the other. Those are the two numbers. It was very, very sad. The reality is that there's a combination of reasons why. One, COVID has caused a lot of the places where we would normally take the children and put them, give them a place that they have left the system. There's been about 1,500 depart the system. Two, the federal lawsuit that the state is under, where the judges has been bringing in outside monitors to look into the system, has appropriately removed some people from the system, some people that needed to be out. So you have that, and then you had the state provided a facility for an ability, a legal way for parents to just hand over their children to say, I'm no longer able to manage caring for these children. And that's caused some children to come into the system. On top of all of this, the economy and the pandemic have led to more difficult times in people's residences in terms of food availability, availability of therapists and mental health. All of these things are almost non-existing in certain communities. Many of these children, when the state has them in their care, even though they have already, someone's made a determination that they need these things, that they need services, mental health, therapies, and others. The only thing that the agency is taking care of to some extent is to have them be watched in a place. And so we have a lot of work to do. It's a very sad state of affairs. And one of the things I'd like to see if we could do is try to get back to as close as much as possible to root causes of this system breakdown. And obviously those have to do, in my opinion, with poverty, with lack of access to healthcare, with lack of affordable housing, so that you can have a family unit that doesn't get into so much despair and so much anxiety and so many problems that there's a breakdown in the unit and that the children have to come into the care of the state. And we've come to the realization, finally, many of us have been talking about this for a long time. Many children are much better off if you can find a responsible, appropriate family setting. You have to be very careful. Not just, one of the concerns I have is that the state is just going to pick any relative without making it an appropriate placement for that child. Some relatives, sometimes children had to be removed from households because it was not the safest or best place for them. And some of those relatives, it may be the same situation. So we can't just try to find a cookie cutter approach to a very complicated problem. And so that's why we didn't get here overnight, and we're not going to get out of this overnight. So I'm glad to be here, Doctor. Sorry for the long explanation.
Thank you, Senator. Kate?
Yes, good morning, or good afternoon, I guess it's just noon. But I am Kate Murphy with Texans Care for Children, and I am honored to be here to talk with you all today about what is going on with our child protection system in Texas. There is so much that we could talk about and unpack, but our key focus at Texans Care for Children really boils down to, I think, two main issues. One is that we really want to focus, we want the state to be focused on keeping kids out of foster care in the first place. We know we have kids coming into foster care when there are better alternatives. We have some kids who are coming into care because we can't get them the mental health care that they need. That's not a good reason to come into foster care. We have kids who are coming into foster care when the main reason is related to their parents' unaddressed substance use disorder. it would be much better to connect that parent with services, right? So we want to focus our energy, and we want to focus the state's energy and investment on services and supports that will keep kids and families out of the kinds of crises that lead to CPS involvement in the first place. And then the other part of our work is that when kids do come into foster care, that their lives get better and not worse, which is too often the case right now. So we want to see safety improved in foster care. We want to see the quality of our foster care placements improved. We want to see more kids in family-like settings. We want to see more kids with relatives, like the senator talked about. So the goal there is really to make sure that when kids are unsafe at home and do need that care and support that foster care can provide, that is an improvement, that they are safe, that they get the help they need, and that they are with people who love them, that they love, that can support them and care about them, and where they can stay stable and really begin to thrive. So that's a very high level overview of our focus, but those are kind of our two main focuses now and leading into session. I would say right now with a heavy emphasis on children's mental health.
Thank you, Kate. Lauren?
Yes, good afternoon, everybody. Like Kate, just honored to be sharing a space with everyone today. I think my perspective is a little different in the way that as the representative from a community-based organization, particularly communities and schools, we come at this from a prevention lens. And so a lot of the work that we're doing in the community and across Texas and across the nation is really, how do you identify youth and families who are experiencing some of those root cause complexities that Senator Menendez noted, right? Youth who are experiencing poverty, youth experiencing homelessness and or food insecurity. Maybe there are some of those signs of being at risk of domestic violence or family violence. And how do you work with families and youth before the crisis ever begins, so that you can wrap those supports around them and ensure that that web of healthy supports, resources, relationships is in place to prevent engagement with the system in the first place. But me personally, as a governing committee member at St. PJ's Children's Home, I'm an ACE interface master trainer, and I provide trainings to groups like Boysville and St. PJ's regularly to help create common language and common understanding of why it is important to do all of that protective work at the front end, at the upstream end, so that we don't have the downstream ramifications that we in Texas are struggling mightily with right now. So excited to be here, excited to contribute to the conversation and to, kind of listen and learn from others who are in the midst of the work.
Thank you, Lauren. Catherine?
Hi there, good afternoon. So I'm an attorney with the Dallas County Public Defender's Office in their Family Law Division, and I represent mainly parents when a custody and termination lawsuit gets filed against them by the Texas Department of Family and Protective Services. I also serve as attorney and guardian ad litem for children that are in foster care out of the juvenile court system, out of the 304th and 305th district courts. I mean, in terms of everything that Dr. Estrada asked about, I mean, I would say that I work every day with my clients to try and get them the best results that we can out of the legal system. Within the mechanisms that we have in order to try and achieve those results, which of course for our purposes when we're representing parents is always reunification with their children and in the fastest way possible whenever we can. And I think that often I end up doing that by contesting every single removal that comes in, which now, of course, since the laws changed September 1st, we don't have petitions to remove children being filed anymore. Everything is being done on an ex parte emergency basis, basically no matter what circumstances they're finding the kids in, if they feel that it's justified. And so essentially, we're battling that every day to make them prove their cases and prove that these children actually are in an emergency situation that could not have been remedied or alleviated in some other form or fashion other than the legal intervention.
Thank you, Catherine. Well, to begin the discussion, Catherine, I'm going to ask you, could you please tell us a story which illustrates the challenges you find in your daily work dealing with parents in the system separated from their children, so that we will get a good idea what's happening?
I mean, it's kind of hard to just pick one. And I'll tell you because like, we have an intern working with us right now, and I was diagramming out the system for her on my whiteboard and realized how incredibly extensive those portions of the Texas Family Code are and how they're being applied to our families in Texas. And the reality of it is that every single case is going to be different. Every single client is going to be different. And what we find a lot is that it's never going to be one factor. So I have recently, for instance, and this is not the norm, but we're finding more and more issues with some of the removals that are coming in based on other factors. But recently I got a client that was 8 months pregnant, and she had there had been a referral that was received where they were alleging that she was selling drugs out of the home. And so they went in, they started a full-fledged investigation. They talked to all of her children at school without her being present. They interviewed all the kids. All the kids made no outcry of abuse or neglect. None of the children, I think they were 3, 5, and 2, could even identify what drugs were. They couldn't identify what the names of drugs were. They didn't say that people were coming in and out of the home. So then the department amps it up just a little bit more, and they asked my pregnant client to take a hair follicle drug test and a UA. And she agrees because she knows she's not doing drugs. She's 8 months pregnant and she has no CPS history for drug use. So she agrees, she takes those tests, and she's negative. So they don't close the case. They ask her to bring in all of her children for hair follicle drug testing. And she complies because she assumes, I don't do drugs. No one in my house does drugs. So she takes all of the 3 children for hair follicle drug testing, and they find that all 3 children have cocaine coming up in their hair follicles. Now, after talking with this woman on my initial consult with her, she doesn't come off as someone that would have exposed her child to cocaine use, much less herself having no history with substance abuse. And so after kind of delving in a little bit deeper and going into any circumstance where they could have had environmental exposure, the kids, I ended up having to talk to her landlord. It turned out she had just moved into a new rental home 3 months before that. And the rental home, turns out, had been a crack house that had to be professionally cleaned, including the air filtration system, the carpets professionally 4 times, the entire house repainted before they could even move in. And the landlord was actually able to provide me pictures of the conditions of the home prior to them moving in that showed the filth and the drug paraphernalia that was present before they moved in there. And it actually turned out through testimony that the children had been in the home 2 days while the home was being cleaned, and had been playing on and off of this carpet and touching walls and touching surfaces, and on and on and on. And once that testimony came out, I still could not get the children back. They would not dismiss the case. So it ended up being a monitored return where the children got to go back into the home once the home was inspected by CPS. That was for 180 days. Now, mind you, I got it closed for her within 60 because, of course, once the home had been professionally cleaned a 5th time, in order for them to be placed back, they were given UAs, and in two months later, another hair follicle, which of course at that time was clean. So in total, her kids were part of the CPS system for a total of 90 days because they moved into a house that had environmental exposure to drugs. And even though there was no abuse or neglect per se, The house was clean, the kids were fed, there was food. That still took up resources, you know, for 90 days that could have been expended someplace else on some other family that actually had children that needed that help. And the other thing about this particular case was that her children were actually taken into foster care for about 4 weeks before I was able to get them placed with her mother, who had been a viable placement at the time of the removal, in fact. So we see a lot of different types of problems that are coming up from the level of investigation that's happening on some of these referrals that are being received by the department. And unfortunately, I've started coining the phrase that they're policing parents now. They're policing families, and it's almost like they're looking for guilt.
Yeah, that's quite remarkable, that story. Last time you also said that CPS was requiring drug testing in parents without the court actually asking. Is that legal? And how reliable are these results anyway, which are often performed by unqualified CPS workers? And how are the results used by CPS and the court?
So you have to remember that the Texas Department of Family and Protective Services is divided up into regions. Mm-hmm. So, you know, Dallas is in one region, San Antonio is in another region, East Texas is a completely, I think there's 13, if I'm not mistaken, I might be wrong, but every region kind of seems to have their own working policies about what their regional administrators and regional program directors are approving for these cases. And so what we see out of Dallas County is that judges do not find oral mouth swabs reliable. So the CPS caseworkers no longer administer oral drug testing in our region. But there is other regions in Texas. For instance, if you ever want to YouTube Centex. Centex is a specialty CPS court, and that judge requires an oral mouth swab before they enter a visit. And if they're positive for, say, for instance, meth, they get their visitation canceled based on that oral mouth swab that is administered by a caseworker. So a lot of that stuff is being directed by regional direction, by administrators regionally as to what these caseworkers are allowed to do. And that's probably part of the larger problem, which is that there's not a lot of continuity in what they're allowed to do and what they find to be reliable. Now, what we see in Dallas is that the testing facilities that are contracting with the department to provide these hair follicle drug tests are not following the procedures necessary in order to cleanse. There's actually articles written about this, but there's a washing procedure that actually has to be done with samples in order to remove external contaminants from the sample prior to them being tested. And we're not seeing that procedure happening at all. And for example, just to give you a short one, I have another case where the guy worked in a warehouse and had no substance abuse history. Actually, in a prior case, had been placement for all of his wife's 6 kids. Well, they got a new referral and he voluntarily submitted to a hair follicle knowing he didn't do drugs. And he tested positive for extremely high levels of meth. And we could not figure out where is this coming from until we started looking at the work environment. He was working at a work environment, which was an overnight 12-hour shift, basically industrial style warehouse where they had shared equipment, they had shared this, they had uniforms, hats, all of those things that were communal. And so what we decided to do was ask that he be tested a hair follicle drug test from his armpit hair. And what do you know? He was negative. So it just kind of solidifies with us, especially as defense attorneys, that there's a lot of external contamination in our populations that is not being filtered out from a lot of the hair follicle drug testing that they're doing. And they're using those drug tests to remove children. So it's a legitimate problem.
That's quite again, that's quite remarkable. So CPS policies are really not what the law is supposed to be. Senator Menendez, in the last special session, were legislative changes that were designed to protect, to keep the families together. But it seems like CPS is really not working according to those. What's going on? What do you think? What needs to happen to get CPS online?
Well, I think what I heard the attorney mention, and she's absolutely right, is that there's because of the larger issue that they're dealing with the children without placement, the leadership of CPS is not necessarily implementing statewide policies. Ironically, here in Bexar County, we've had a decrease of about maybe 80% of the cases that have been even brought up by lawyers, because there was a bill that was drafted to make it much harder to separate children from their families, House Bill 567. And so we've seen a dramatic decrease in that to the point to where we had 2 kids here in Bexar County who it's arguable that they should have been taken out of the situation they were in, and they ended up passing away in the care or due to the neglect and abuse that they suffered in their homes. And so this is a delicate balance. Without a doubt, 100%, we should not be separating children from loving homes without any, especially any kind of due process, without any outcries. The examples that have been before us are ridiculous and just horrific because of the trauma that you put in on the kids, the fear. Anytime you bring a child into the system, you're inducing some level of trauma, not knowing when they're going to see their parents again, not knowing what's going to happen. And so it is disheartening to know that we have a system that is so broken. So we're working on this, doctor. I don't have a magic bullet in front of me. I don't have any smart off the cuff remark. I can tell you that I'm going to need the help of people like you, the attorney on the call on the Zoom, so that we can get the best information that we can to help the kids. And we're hearing from a lot of grandparents and a lot of family members that they feel that they've been unfairly, isolated, pulled out, brought into the system, if you will. But by the same token, we also have to make sure that the kids who are in danger are that we're not unnecessarily overreacting and not putting them in a safe place. And so we have a lot of work to do. I don't have a response other than it's a big problem that's very broken.
Thank you, Senator. We have 2 questions already. Dr. Dean, do you want to ask your question or your comment, please? You're muted, Dr. Dean. Mina, you are next.
I'm a retired pediatrician who specializes in London area, although reporting children to child protection is a responsibility of a physician or anyone really that identifies any problems in the home. But in pediatrics, really early identification of the at-risk child and early interventions are important. And so when we discuss identifying the at-risk child, that seems to be an issue in many of your presentations. The problem that a physician has is really if we identify a problem other than reporting to CPS, is there such as food insecurity or housing, something that could lead to a problem? There is no uniform or one-stop place we can send the family to that'll navigate them through what's available in the community. And I think San Antonio has a lot available to them in the community. It's just difficulty accessing it. So I'm just curious what your input into identifying that at-risk child, and who do you work with other than physicians or churches or schools? How do you organize this early identification process? I'm sorry if that's too broad a question.
That seems an ideal question for Lauren. Do you want to tackle that?
Yeah, I mean, I think I wish I had a magic wand and I could have authentically integrated health services as just a standard operating model, right? When I think about some of the best practices that exist out there, it's pediatric clinics that have mental health care integrated into the clinic. So they don't have to make one more visit to another space, right? We've seen that work really well. And then having our pediatricians screen for things like ACEs, screen for things like housing insecurity, food insecurity, right? Working to screen both the children and their caregiver. So you're getting both perspectives. Unfortunately, we haven't made progress in really authentically assessing or evaluating our clinic or our patients in those clinics. And furthermore, we don't allow our pediatricians the time and the space to do that kind of work. They're so overwhelmed moving from one appointment to the next that it wouldn't, as the current system operates, it wouldn't easily fit into the system to have those types of conversations with the patient and with their caregivers. So I do know that there are one-off instances where people are aware of community health workers or the Wesley clinics that Methodist runs in San Antonio. There are some relationships between agencies like communities and schools and healthcare providers, but in no shape, way, or form is this standardized. And so I do think that this is rethinking a system in general and not putting the onus on any one individual, but that all youth touching professionals, whether they're educators or doctors or youth development professionals and out of school time programs, that everybody is educated to look for and identify key indicators of youth being at risk of child abuse or neglect.
Great. Thank you, Lauren. Kate, do you want to expand on your comment in the chat?
Yeah, sure. This isn't something that's in existence yet, but it's something that's being talked about a lot, at least in the advocacy community and hopefully at the legislature as well. But we're part of a collaborative called the Prenatal to 3 Collaborative, PN3. And one of the things that group has been focusing on is using 211 to connect families to services more, and using that as a warm line when we know that we have a kid and family who need to be connected to services, and shifting from a system that requires mandatory reporting to mandatory supporting. So we know that there are people, I think, who know that there's something going on, know that there's help that's needed, and they think the only option is to call CPS. Nobody's required to call CPS for anything unless they reasonably suspect that abuse or neglect is occurring in the home. So there are lots of other options when it's a service issue, when it's a poverty issue, when it's a connection issue, but it's hard to know what those resources are. 211 is a good resource for that now, but there's talk about really operationalizing that to try to make that a more robust option and a clearer, more well-known option for people who are wanting to connect families to services rather than report to CPS when they know there's an issue in the home, but they're not really suspecting that abuse or neglect is occurring.
Is there information available? Is that just in Austin? Is 211 operational in Bexar County also?
Yes, it is operational in Bexar County. I think it's run by United Way. And I can send some resources about 211 and what some of those conversations are looking like.
Good. Good. Well, thank you. Um, there's a comment on the chat. Debbie Jennings, do you want to talk about what you're texting?
Oh, sure. My name is Debbie. I'm a nurse in the community. And one thing that we realized is that there is, my doctoral project was actually centered around developing healthcare resources for youth that age out of foster care. And we saw that as a significant gap. When you take the American Academy of Pediatrics has deemed youth in foster care as one of the high-risk populations, yet we don't have any, channels for them when they age out to connect to resources.
Mhm.
So something, Dr. Dean, that you were referring to is exactly the gap that we saw when you bring somebody in and they need healthcare services. So linking them to workshops around health literacy, how to access, healthcare on any level. What does their insurance card look like? So, and creating medical homes for them. And so Dr. Karen Schwab, who's on the call too, is with Wellness 360, and our vision is to create medical homes on college campuses where youth are in foster care, attending the campus. So really putting that reach out into the community of San Antonio has been exciting.
Great. That's wonderful information. Thank you. Mina, do you want to ask your question or do you have a comment?
A comment. We heard a lot about the hair drug problem, which is a lot less than the trauma problem. And so the biomarker we have now is a hair study of the cortisol. And if the relationships, responsive caregiving, and environmental epigenetics are good under 5 years, there is always a resilience built into the system. And this is, I'm talking about with my experience in 79 and many pilot studies. The problem here is the pediatricians are not trained on catching the red flags when there is a trauma, perceived trauma by the infant under 3 years of age, which is the primary pathway that is a big gap. Secondary, the trauma goes on and we haven't caught them thinking that the boy cannot speak early, the boy cannot be can be hyper. So there is a biomarker now. I think instead of just the drugs, we have to look for the hair cortisol. That's important. And even if there is negative for drugs, and if the cortisol is high, this child is under great stress and they have act out behaviors. To close this gap, I think every primary care practice should have mandatory training in doing catching the red flags and reporting and working with the families and learn a lot about child trauma and prevention. Mm-hmm. Unless the CPS system is totally, foster care system is redesigned, we are taking children, dumping them with a family, thinking, oh, this is a good family, they could go. These are so traumatized kids who froze in dissociation, froze in withdrawal, they're so insecure, they're going to act up. When they act up, they go from one foster to another foster. Your system has to change to start the healing therapy for 3 to 6 months time. Well, by the time they enter the foster system, we already have a less capability of healing them fast enough. And there is a high incidence and prevalence of recidivism, and there is insecurity. So unless we redesign the whole system to start healing, bring the families together, just like we do the NICU training, and do this at schools, do this, through the system itself. So we're pushing them out of the system into the families. The families are not ready to take the challenges. Oppositional defiant disorder, explosive temper, inadequacy, no self-identity, self-rejection. How can children survive and thrive?
Yeah. Yes,
You're right.
You're right, Mina. Speaking about that, Lauren, you gave us a really nice explanation about the short and the long-term effects of being in the system for these kids. Would you like to talk a little bit about that again, please?
Yeah, I think Mina really touched on a lot of that, and it really lies in the neuroscience of development, right? So if you've got a child who is exposed to stressors and they're consistently exposed to those stressors, our brains produce cortisol, and cortisol in high doses, it can fundamentally change the architecture of the brain and how it develops, right? And so when we think about children who live in radical complexity, right, the short-term impacts of removal, right? So the legislation that Senator Menendez referred to by Representative Frank, it makes a lot of sense when you know the science of how, you know, forcibly separating a child from the caregiver they've attached to, it creates a cortisol overflow like nothing else, because they don't know where they are, they don't know who they're surrounded by, they don't know if they're going to see their parents again, and it's just a persistent flood of cortisol, which then creates all kinds of inflammation within the body, and it starts to grow those fear centers in the brain, right? So then their brain just develops around a context of consistently being in fear. So short term, right? Short term, we're looking at the fact that, you know, kids who are removed and they are engaged in the foster care system versus kids who are not engaged in the foster care system, 7 times as likely to experience depression, 6 times as likely to exhibit behavioral problems, 5 times as likely to experience diagnosable anxiety, 3 times as likely to have ADD, hearing, vision issues, 2 times as likely to suffer learning disabilities and developmental disabilities, right? And those are short term. When we think about long-term implications, right? We're talking about the statistics that will break your heart. This is 1 in 5 are going to immediately become homeless when they age out. Half are going to be unemployed by the age of 24, which means half are not employed by the age of 24. 3% earn a college degree, less than 3% in most states. 71% of the young women who are systems involved will be pregnant by 21. At least 1 in 4 are diagnosed with PTSD or complex PTSD, 60% convicted of a crime. I can go on and on and on, right? So the less radical trauma the more we can prevent children from experiencing radical trauma, the better their brain and body develops, which allows them to develop those capacities to thrive as youth and as adults. But if we continue to layer on those complexities, it creates worse and worse outcomes. And these, I'm talking about individual outcomes. There's been studies shown, like in Tennessee, that the cost of ACEs across the state of Tennessee is over $1.5 billion annually, because you're talking about healthcare costs. You're talking about people who aren't contributing in positive ways to society. You're talking about people who are falling through the system. And so we are paying those costs in our tax and in our social fabric, initiatives. But if we could reduce all of that on the front end, right, instead of spending $3 trillion as a nation on those downstream health impacts that are related to ACEs, pour that in on the front end, pour it into our nursing programs, our early childhood programs, pour it into our schools, pour it into nurse-family partnerships, right? That's where you do the magic shift. But, I don't have control over those levers.
I think everybody has to really rise to this mental health crisis. It's not only mental health, as Lauren has said, that hypertension, the sick heart syndrome, the diabetes and the obesity and everything is related to that. Kids are falling dead because they have cardiomyopathy because of this stress, chronic stress that was never picked up either by the health caregiver or by the schools. I think we have to unify the commission between the schools, the pediatric clinics. You don't need a mental health center in every clinic, or a mental care, healthcare home. You need to identify them from prenatal through the first 5 years. That is the long term. And the short term is you already have a problem. You need to really understand the root cause and you need to heal. Healing is not happening. Drugging is happening. You heal when you put them on a point of self-confidence. And that's my personal experience. I might not have published papers in journals or articles, but thousands walked through my clinic where I never sent them to a psychiatrist to be drugged. I monitored my problems and I made the parents unlearn what they have learned. That is a cycle of violence you have to stop. And I invested on that.
Right. Well, besides the help that primary care physicians like pediatricians finding and following and guiding parents and children through this issue, what happens in the school? Lauren, I'd like to get back to you in terms of what are the services that your organization can provide to these children?
So for those not familiar with Communities in Schools, we are a national organization. In Texas, right, we are nested at the TEA. And so we have a state office that our state legislators like Senator Menendez very generously support through legislative line item dollars at the TEA. So there's 28 different affiliates across Texas, and each affiliate does something a little bit different than the other. But at the end of the day, what we do on a campus is we place a social worker or a counselor. That's typically the degree that our staff have. And they are on a campus all day, every day to do two fundamental things. One, case management, right? There's a subset of kids at every campus who need more than just a pair of shoes. They need support of a healthy adult over the arc of the entire school year to help them with those one-to-one relationships to overcome barriers with academics, behavior, mental wellness, attendance, those things. But we know that those database complexities, whether it's their grades, their attendance, their behavior, that has root cause. And so by bringing in the other pillar of work, which is the wraparound services, you can really start to address some of the root cause issues. A child may not come to school because they are taking care of siblings, right? Because their parents are working multiple jobs and they have to get their siblings up to get them to school in the morning, or a sibling is sick and they've got to stay home with that sibling. We saw a lot of that during the pandemic, where kiddos were responsible for other kiddos and they didn't have time for their own schoolwork. They didn't have time for their own well-being because they felt the responsibility of taking care of others. So if we can identify those issues, if we can identify that they're experiencing housing insecurity, every time a child moves during their K-12 years, they are pushed back 6 weeks in their educational progress. And some of our kids move and move and move. Housing is a super root of poverty. And if we can't ensure every child has a safe space to sleep every day of their, formative years, we are failing as a community. So that work on the campus to do that wraparound work and the case management work, relationships plus supports, that is really critical to moving the needle. In one instance, a way in which we're directly working with youth who are systems involved is we partner with City of San Antonio Head Start and SAISD, and we provide clinical mental health professionals and social workers who wrap around these families, many of whom have been referred to Head Start because they had a CPS case or currently have an open CPS case. And so that's the way in which we are helping bring that community of care to those families so that either they aren't effectively removed from their home and or do not experience recidivism around those removals.
Also, the early Head Start program for 0 to 3 years through the public school system, it's a good plus point. I think more than the healthcare workers, I think these teachers and the PhD psychologists and therapists seem to know more as to what to do with the 0 to 3 and 0 to 5. That's a very bashful thing for the medical world, but again, that's happening. So, much can be done when you start early and you're studying, and that's not happening. So there is so much to do, but pertinent to the foster care, we totally have to redesign the system.
Yeah.
It's not going to work the way it is. You're going to have loopholes. We're rushing the kids out of there. They're not ready to heal. And there will be a lack of continuity of care, physically and mentally, both. They're very insecure children.
Yeah.
When they got there, they're very insecure.
Yeah. Senator, did you want to chime in?
Quite honestly, I think everybody who's speaking is handling the realities that we're dealing with, and it's good to hear the experts talk about the health, long-term implications of us not addressing the system correctly. And I think too many times we get caught up in a system. Sorry about this. I'm having trouble with keeping my iPad in one place. We get caught up with the much more black and white, stark contrast. It's, well, either the child stays and they're in danger or they go, and we're asked to set up laws and policies that in many cases don't leave room for nuanced situations. And then and then when we try to do that, we get to people who take advantage of the flexibility one way or another. And so what I like best of this conversation is trying to get to the root issues of what's going on. And I've heard already things that I was personally aware of, but if we could figure out ways to get data, because I work in a place where anytime we make an investment in what should be just intrinsically the right thing to do, it's always put in almost in a financial perspective. What's the return on this investment going to be? Even though that's not their money, it's the taxpayers' money. And I agree that we have to be cautious, but I think we need to have the numbers that show when you have this type of trauma on kids, and you know that the long-term outcomes of these kids who end up in the foster care system are going to be so negative, then we as a state, it's not only the right thing to do, but it's in our personal best interest to make the investments on the front end to keep them from being in the foster care system, to keep the families together, to keep them in a household, to provide them the healing that the doctor talks about, so that they can thrive in a safe way. The problem is that because we do have to start this from the beginning and recreate this, it's going to be very complicated, very difficult. You have some very large institutions that have been created around this, and there are a lot of people that I hope due to the right reasons, but there's a financial incentive and system that's created around this, and I hope that doesn't keep us from tearing this thing down. Now, the problem that you have is this: if you want to tear down the system and rebuild a new one, you're still going to have the problem of children in the system. We don't have the luxury of putting a pause on children coming into the system. And so we have to figure out how do we best transition into whatever it is that we're going to go through. And so it's going to be very complicated. It's going to be difficult. I'm up for the challenge, but I don't want anybody to come away from this thinking that we have all the answers, we know what to do, don't worry about it, next session it'll get fixed, and this problem will be over. Heck, we've been talking about this problem for decades.
Yeah.
And I think I hope that we're not talking for future decades. I think that it's going to require a lot of work. And so the good news is I'm hearing a lot of evidence-based arguments for why we need to make the changes. And I think the evidence-based arguments will give us the enough, I hope, motivation to make the changes that will also be the right thing to do for the children and their families.
Yeah. Thank you, Senator. Pat, you have your hands raised. Dr. Herndon? Do you have another question, Dr. Dean?
Yeah, so you
Okay.
have can you hear me now?
Yes.
Well, let's just start with the legislature, which I've been involved with since the 60s. And only go back 3 decades. 3 decades when I came back to Texas. I was working in the legislature then. And, I'm med-peds trained, and I do a lot of highfalutin medicine, but I also serve as an expert witness for a lot of things, including child abuse, neglect, and exploitation. And I went to a Casey conference back in the early 90s. And one of the speakers there was a young man that was about 23, maybe 24. And he had been placed in foster care when he was a teenager. He'd been through 17 placements. He had been raped. He was HIV positive. And that was at a time when we didn't have combination drugs, so we couldn't control the disease very well. We quickly developed those combination drugs. Even prior to that, I had seen one of the best pediatricians I ever knew accused of sexual abuse of a child by a neighbor who had adopted a child. And by the time that was all over and his career was destroyed, the state had to pay back all of his legal fees because they couldn't get a conviction. There was, in my work with the warrior mommies and autistic kids in the last couple of decades, I've discovered a probate judge in Tarrant County. And he's a probate judge, and the probate courts now take care of guardianship for disabled kids. And his wife was the head of the MHMR in Dallas County. And she ran a professional guardianship corporation that had 500 guardians in it, 500 wards in it. It had 9 professional guardians to take care of 500 kids who were supposed to be seen at least once a month by their guardian. And nearly all of those kids that were in that corporation, that guardianship corporation, had been referred to her by her husband, who was a probate judge in Tarrant County. And I can go on and on and on with these stories. My question is, this has been going on forever and ever, as long as I can remember. And I just don't understand why. I mean, having spent all the hours and years that I spent working in this legislature and in the legislature in Tallahassee and in the legislature in Sacramento, we're not getting anything done about it. And everybody here knows what the problems are. And I think there's a lot of solutions that come along with our knowledge of those problems and the data, but we can't seem to produce an institutional public solution that eases the problem. And then of course, along comes a pandemic and everything gets worse. So that's my question. What can we do to address this head on in a larger way? We've been biting off little pieces of it here and there and attacking it and noting the problems, but we really haven't done anything comprehensive. And that has to be led by public institutions, by government. How come we can't get anything done?
I'm gonna ask Kate to tackle this huge question. I mean, I know she's done a lot of work in the legislature and advocating for reforming the system. And she also mentioned that there was an initiative, she was working on an initiative to bring together stakeholders from cross systems to bring down the silos in the system to better contribute to this conversation. Kate, please.
Yeah, the easy question, right? I share your frustration. So let me just start by saying that it is, it does seem like it's just kind of a repetition of problems, and we take one step forward, 3 steps back, or we do little things to try to change big things, and it's not enough. And I think, the challenging part is that's sort of the nature of the beast. It's really hard to do comprehensive change all at once. It's really hard to get agreement on comprehensive change all at once. I think increasingly more, and I'm glad for this, there's a recognition that we need to be focusing on the entire family. When historically, I think the focus has been on the child, the family has been demonized and left behind. I think there is a shift on focus toward prevention. I think that is a positive thing. And I think there is a recognition, at least, that our systems don't coordinate well or collaborate well or work particularly well together and that we need to change that. I wish I could say that I had the perfect solution. I have a lot of ideas about things that we could start to change, things that we could start to shift that I think would be very impactful and make a difference. And I'm happy to go into detail about some of the ones that we're focused on right now if you would like me to. But I think one thing that is just really important to note about anything that we try to do legislatively is you can't legislate a culture change. And just because we have policies on paper that read well and look good, whether they're agency policies or laws that we have, that doesn't mean that there's buy-in from people who are administering that at the local level. It doesn't mean there's buy-in, with middle management. And that can make it really hard. I think the system itself is very resistant to change. And it's been deeply, say it one more time, deeply underfunded, especially when it comes to funding prevention services that support the whole family, funding poverty interventions, funding those things outside of the system that can help keep families together. And there is a lot of little problems, right? Like nobody thinks about, not nobody, people think about it, but systemically, very few people are thinking about problems with drug tests that Catherine described earlier. That's something that we've been aware of. We talked about it some in a policy brief I put out a few years ago related to parental substance use. It's our stance that substance use in and of itself is not child abuse. It is currently part of our definition of child abuse. We think it should be taken out of that definition. So there are lots of little things and lots of big things that are all just baked into this system that, even if we get the right policy on paper, that doesn't mean it's going to translate to the type of transformation that we would hope for. And so, like I said, I'd like to say that I have a really clear, crisp answer for you, but there are just so many things that factor into it that are so complicated and deeply entrenched, systemic bias, but so many things that there's no simple solution, but I think we could do a lot by getting the investment right and in the right things. And I hope that we start to see this shift towards supporting families really start to materialize as more and more people are gaining awareness of that.
Thank you, Kate. So how can medical professionals help this process? Not just of healing these children or identifying them, but legislatively wise?
So Kate gave a great response, but I think sometimes what is missing, especially if we're trying to testify on legislation, a couple things. The day-to-day practical implementation of something. So if you have someone on this call who says, like the attorney, whose her day-to-day real life experiences could provide very insightful as to why some of these drug tests are unreliable and could cause a terrible outcome. And we know that we don't want to separate kids from their parents. We have a good mother who's doing everything she can, who's been accused of exposing the kids to drugs. If it weren't for her good work, they would have been separated and part of the system. And so we need the people who are on this line to bring their day-to-day life experience, their anecdotes to the table, to organizations like Kate's, to my office. So if we're working on legislation, so that we can have people who are prepared possibly to testify on behalf of legislation or against legislation next session when we're presenting legislation. Obviously, whoever the author of the bill is will do their best to explain why it's necessary. But we're not experts, and we're not living this life, and we're not treating patients on a daily basis like the doctors on this line are. And so many times I have seen legislation move forward because they see someone who is a subject matter expert who can talk about a real life experience on how this legislation can either help that situation, or how, if the legislation's passed, it might worsen a situation. So you have to be prepared both to testify for and or against particular legislation. And I think it makes more of a difference when they see people that they don't see all day, every day. And they see me, and they see Kate, and they see others who are paid to be in Austin to be advocating. And so that's a helpful thing. And so I think I've heard from several people that I think would make great witnesses. So if you're interested in that, please, provide your information to you, doctor, and let us know how we can put a list of people that, if legislation comes up. The other thing is, if you have ideas for legislation, if you say, I'm sick and tired of these things happening. I keep seeing the state do this or the agency do this. Is there any way we can address it? And some of these might be by rule that the commissioner of the Department of Family and Protective Services or Health and Human Services can change by rule, or it may require legislation to impart the change. So, but Kate was on spot on in the fact that sometimes, due to the fact that there are so many people and the system is so large, that even when we pass certain bills, there's a resistance to implement them. And so we're going to have a collective effort, and it's not going to be easy, but we can get through, we can do this. It's good to see people who care enough. Part of the problem, when I heard the gentleman talk about him working on this and doing this for the last 30 years, is that over those last 30 years, so many people change. They change places, they change positions, and the problem doesn't change. There are different ways of looking at it. And hopefully we get to the point where we get enough people who have the political will, and they're equipped with the correct science to make systemic changes that we need. And that's what we need. We need systemic changes, foundational changes, in order to address this from the very root of the problem. And y'all should also know that the children who are going through this trauma today are going to end up having children, and the cycle continues until we break the cycle. And so it is not a surprise. It is a sad tragedy that we're doing this, but it's because we have never addressed the root causes of this trauma that these kids are going through. And that's what's hard. It's difficult, but it's going to require us going to the most difficult. And when we do throw money at these situations, it's more in terms of band-aids, approaches of paying someone to watch the kids, rather than trying to figure out, why did the kid get in the system in the first place, and what broke down. And so that's why I think we're still here.
Just let me piggyback on that quickly.
Sure.
The senator is absolutely correct. And it's a matter of professionals who know what's going on, banding together and going after it. And that means going after it in the legislature. It means persistence. You have to learn that the first time around, you're not going to pass it. Probably the second cycle, you're not going to pass it. If you pass something this monumental in 4 cycles in the legislature, you've accomplished a miracle. I mean, that's how, and just getting people that know it, they're exposed to it, and getting in contact with political power, and just riding it through, just staying at it. That's how we passed the guardianship changes through Senator Zaffarini's office. We wrote 9 laws, and 8 of them got through because Zaffarini and I picked a Republican committee chair, a very old senior Republican committee chair on the House side, and talked him into this and put them together. And that's how we got all those reforms, those guardianship reforms through, and the Bill of Rights that now is part of the DHS law, rules, code, whatever you want to call it. And it's a matter of timing, and it's a matter of persistence, and just standing up and doing the work and recruiting the witnesses.
Yep, that's it.
Yeah.
That is correct.
Okay, any other questions, comments? We have a few more minutes. We are supposed to be here until 1:30, so please feel free. I know there is a lot of issues. So one of the things that I wanted to for Senator Menendez to tell us is why is it so important to, and how can we support kinship caregivers?
Well, I mean, I think those of y'all who are familiar, kids, the trauma, and I'm not a doctor, I'm not a scientist, but the trauma that I can imagine, I'm going to guess these children are feeling when they get yanked out of their family unit and put with perfect strangers is, where am I? Who am I with? What am I doing? So if you can find responsible next of kin, a grandparent, an aunt and uncle, or someone who has the capacity to provide a safe place, we know for a fact that the children do much better. So the problem that many of these grandparents have, though, is that many of them are on a fixed income, and they get a call in the middle of the night, and they don't have sometimes they don't have the diapers. We know how hard formula is to come by these days, the cribs, the things that they need to take care of these children. So communities around the state, and Bexar County has one of the largest, have started to band and put together groups of one of them called Grandparents Raising Grandchildren. And they're helping identify the needs and helping bank things that they can help other grandparents that get that call in the middle of the night. As a state, I've been pushing for us to do more in terms of financial support. If we know that a child, if not for these kin, they're in the foster care system and we're going to be paying X amount of dollars per day per child, why would we not let that money, at least some of that money, if not all of it, follow the child into a situation? Because let's say if you have a foster care family, they've been through training, they've been licensed, they've been there, all of these things they've had to go through. If I were to receive a phone call and someone in my family needed it, and they call me and they go, would you take them? Sure. I would personally not take the money. I would just want to have the child. I want to help take care of them. So the issue is that as a state, we should allow for the same financial support to those families who are in need of having that financial support. That's why I think it's critical that we support the next of kin who step up. It doesn't mean that we just forget about the children. It means that we keep up with them and we ask them how things are going, how school. I mean, we're not looking to strip children from their families, but it would be obviously a much better place for them to be than in the foster care system. And so if your question, that was a long way of answering, what can we do? There are organizations that we can put you in touch with. And then there are laws that we want to change to make it to where it's just institutional, that kin also get the financial support if needed. If they, I don't know how to, I don't want to throw out a line to say if they qualify, because then someone's gonna say, well, they qualify under these conditions. And let me tell you, some grandparents have been told that the only way they're going to get help is if they get rid of all their cars and they pass all these asset tests. And it's just ridiculous that you're going to tell them, we're only going to help you if you have no way of supporting yourself. That's stupid. And we just have to find a better way to do this. So it's another complicated problem, another complicated answer. But in the meantime, there is a nonprofit organization that's doing good work.
And it's worth noting, just quickly, that we've been borrowing in people. Maybe everybody on this Zoomcast doesn't know what borrowing in is, but it's when you take a ringer and you insert that person into the bureaucracy of government. And we now have a pediatrician who's just gung-ho, and he's running Medicaid, Medicare in this state, Medicaid in this state. And that's a big asset to have somebody that can control that much money and that big of an institution when it comes to bringing assets as well as bringing regulation and laws to the legislature that can get through. So it's a big ally there, and there are other allies like him. And burrowed in, or literally burrowed into the state government now. And we're going to keep on doing that.
Yeah, thanks for bringing that up, Pat. Kate?
Yeah, I just wanted to add with the what we can do around kinship care, particularly around what we might be able to do for them this legislative session. And I also love Texas Grandparents Raising Grandchildren. They're one of my favorite orgs to work with. But we are 100% with the senator on trying to get more financial support to kinship caregivers. Right now, some do get the same level of both tangible support and financial support as foster parents, but that's only if they become licensed foster parents themselves right now. Others have to be at 300% below, at or below 300% of the poverty level, and then they get half what foster parents get. To us, it doesn't make sense that we're paying strangers who may very well be better off financially to begin with more to raise children than family members. So we want to see that investment in families, but we also want to make sure that kids who are placed with kin also have access to that case management support and other services and supports that are needed that aren't just those financial services. So when you have a licensed foster parent, you have a case manager from a child placing agency that is working with them, providing support for them, providing legal advice for them. And kin who aren't licensed foster parents don't have access to those supports either. So they're really on their own. We do have kinship case managers at the agency who try to help them. They're very overworked, they're very overburdened. And so there's just a lack of options. And we know that kids who are placed with kin, even though they have access to less resources, tend to do much better and have much better long-term outcomes than kids who are placed in foster families. Staying connected to people they know, staying connected to their community is really important for development and reducing trauma in all kinds of ways. And so we want to make sure that kids have access to the services and supports when and where they're needed. So there are a lot of things we can do, I think, to build out supports for kids in our mental health system. Senator Menendez had a wonderful bill that is taking way too long to implement that would help get more services to kids who are on Medicaid, which would include kids placed with kin, less restrictive services. So there are lots of things besides just the financial piece. There are lots of things we could do to make sure that kids who are placed with kin are also getting access to other help that they need that is closer to what a kid who's in a foster home might experience.
Thank you, Kate. Although there are some issues that may affect that relationship for kinship caregivers. Last time, Catherine was talking about some of the issues that may interfere or may may give problems to kinship caregivers, such as misdemeanors and things like that, that CPS brings up and are on the way for family to be caretakers. Do you wanna talk a little bit about that, Catherine?
So what I was referring to specifically was CPS's internal policies concerning who is eligible to receive what they call FCON, which is the Fostering Connections program, which is the financial benefit that was just being discussed about them becoming licensed foster parents first. The problem with that is that there's a lot of qualifications that have to be met in order for a family to even qualify to apply for FCON. And one of those is that they cannot have a criminal history. And if they do, I believe they're by policy, it might be a 20-year. They do look at the number of years that it's been since the offense, but there's a lot of offenses that exclude you altogether. So like, say for instance, you got a DWI when you were 21, 19 years ago, or something like that, you're right inside that bar where you're not going to qualify for the financial benefit through FCON. Now, it's my understanding that there is some other little stipends that they do give those families that don't qualify for FCON. I know that there used to be a one-time payment of $1,000. I mean, it's pretty minuscule. It's not a lot of money. But I mean, they do try and find other financial things that can be given to the people that do not qualify for the FCON. But for instance, if you're undocumented, you're never going to qualify for the FCON if the grandparents aren't from here. If they're from Mexico, for instance, and they only came here to take the kids so that they didn't go into foster care. Those people are never going to qualify for an FCON payment, or probably much financial support at all from the department if they're caring for their grandchildren. The other thing is they have a lot of requirements about the size of the home, about the square footage per kid. The kids usually have to be separated by sex. So if grandparents are living in a 2-bedroom condo and there's a boy and a girl, generally they don't want the boy and the girl to be sleeping in the same room. Obviously, some of that is age dependent, but there's a lot of little things that I've found kind of will disqualify a lot of the relatives that we find on our cases. Also, if they've ever had CPS history. And by CPS history, I mean, it doesn't even need to be their child. They could have just been a home member, say, for instance. Maybe you were living with your ex-husband and your ex-husband's ex-wife picked up a case and you were listed as a home member. That's going to actually show up on your CPS history as well, because you were living in the home at the time that the referral was received. So, and some of that stuff can be looked at administratively, but it's just the rigmarole of having to jump through those hoops for a lot of the families that want to apply for the FCON. It can be difficult and it can be lengthy and it can be strenuous for a lot of, these older retired individuals to kind of jump through. And it's not a fast process either. So even after they do become licensed foster parents and qualify for the FCON, they still have to have placement for 6 months before they can negotiate a subsidy.
Yeah. Well, there's lots of hoops, but Kate, you had something on the text.
Oh yeah, I was just saying that a lot of the barriers to licensure are set in federal law. And so that's why we're not necessarily pushing for all kin to become licensed, but rather to have the same types of financial support and other supports, other softer supports for kin who are unlicensed. None of those things, none of those barriers are things that exist in state law. They may exist in state policy, it may be how things are implemented, but the licensure barriers don't apply. There's a lot of flexibility and a lot of loopholes that are actually written into state law for people who have criminal histories and things like that. So there's been a lot of work done but that what they have available to them is a lot less than if you were to become a verified kinship caregiver. And so rather than requiring everyone to become verified when we don't have control over all of the potential barriers to getting them access to help, we're hoping to see just kind of a leveling for families that are unverified and families that are verified.
Question?
Thank you.
Catherine, what are the current FCOM regulations about housing vouchers, about Section 8 housing vouchers? Because there are all kinds of exclusions for that. You know,
I actually don't know of any exclusions for that. I think they probably look at that in the same way that they do their budget and their the monthly expenses that they require be documented and turned in. I mean, that's part of the licensing process anyway. They have to verify their income. They have to verify their monthly budget. They have to be able to show that they can basically support the children without the financial assistance, if that makes any sense. Because obviously they're not going to want to put kids into a home where they're not able to provide them. So I have not run into it being an issue about housing vouchers or rentals, or you have to own your home. I think that's less of what they look at. I think they look more at, can this person financially provide for the child overall? You know what I mean? I don't think it has much to do with like whether they rent or they own or they're on housing, or I mean, a lot of our families are on government assistance and they're still taking care of kids that are in foster, you know, should have or would have been in foster care. So I think it's more just about the monthly resources of the family in general. I haven't seen much about vouchers or housing, but I don't know about in Bexar County, but here in Dallas, it's extremely difficult to get a housing voucher or to get into the Dallas Housing Authority over here. I think I had one client that was on the wait list for 5 years before she was finally approved for a 4-bedroom, 2-bath apartment.
Okay, well, it's time to go and have some lunch. If you haven't, I would like to thank our panel. Senator, thank you so much for your support. Kate, we're very happy to have you, and we're looking forward to working with you. Lauren Garrity, thank you again for being so supportive of our organization. And Catherine, you're always a delight. And by the way, you know, she's my daughter, so I love you. And so you guys, all the people who stayed on the call, thank you again. I just want to remind you that this recording is going to be available in our YouTube page. If you want to send it out to your contacts, I think the information has been extremely important about the issues we are facing in trying to reform the system. And so thank you again to all of you. And please have a safe and a good weekend.